name is Melissa Radcliffe, and I'm going to talk to you today about nursing in a Mei Tai. Nursing in a Mei Tai, in my opinion, is one of the easiest baby carriers to nurse in because it's very easy to loosen and tighten the shoulder straps to adjust the baby high or low on your body. So I'm going to be using my weighted baby doll here, who's about the size of a 4 to 6 month old, to help me out with this video. When you're nursing your baby, you generally hold them in a cradle or a cross-cradle position, side-lying on your body. When you're nursing in a Mei Tai, your baby is going to be more in an upright position, but lower on your torso and slightly crooked. So they're going to be in this position to nurse when they're in a Mei Tai. Now, the anatomy of the mother and the age, strength, and nursing proficiency of the baby will affect how easy it is for you to nurse in a Mei Tai. If you have large breasts, you may find it a little bit more difficult to nurse in a baby carrier. And if your baby is especially young or doesn't have a lot of good head control yet, sometimes it's a little bit more difficult to nurse. But as your baby gets older, they will be able to nurse quite easily in a Mei Tai. Another thing that is tricky for a baby learning to nurse in a Mei Tai is that they're learning to nurse sitting up. Since they're used to being nursed side-lying, sometimes nursing in a sitting-up position feels a little bit strange to them. So you can practice by having your baby sit on the couch and nurse. And those of you with older nurslings or older children know that by the time your baby is about 6 months, 8 months, 10 months, they will nurse anyway. You'll let them. So let's get started. I'm going to start with my Mei Tai. And I'm going to tie it on high and tight, just like normal, always with a square knot, never a bow. And then I take my baby, and I put her on. And again, tie with a square knot, always a knot, never a bow. When my baby's on, you can see she's nice and high in my chest in the same position I was holding her in my arms. She's close enough to kiss, and I can see her face. So I know that my baby's in a great position. When she starts getting fussy and wants to nurse, there are a couple options. If you have small breasts, you can just reach your hand right into the side, scoot your baby over, and kind of pull them up and out. This is often enough for many women. If this doesn't seem to work for you, you can move your hands along the shoulder straps to the back and loosen up your knot. Let's see that again in close-up. To loosen the shoulder straps, you're going to start by tracing the shoulder straps to make sure you're holding onto the shoulder straps and not the waist strap. To loosen it, you just stick your fingers in through the knot and loosen it up and tighten it. This I've exaggerated to show you how to loosen the knot without untying the knot. Let's do it again and show it in the smaller increment, which you will actually be using to lower your baby down. Okay, so to review, you feed your hands down along the shoulder straps to make sure you're untying the shoulder strap. Stick your fingers through the knot, you loosen up just a small amount, and that will drop your baby lower in the baby carrier. Now that your baby is lowered, you can see that their mouth is right at breast level. So I can reach one hand in through the side of my Mei Tai, and I can reach the other hand in the other side of the Mei Tai to help control their head. So from here, we get the baby latched on, and then you can put your arms around them, and perhaps you'll need to tighten one strap or the other to give them nice, good support across the back of their head. So as the baby is nursing, you can pretty much be hands-free unless you have larger breasts, and then sometimes you may need to keep a hand cupped to your breast. When you are nursing, you can either nurse out of the top of your shirt, or if you're wearing a nursing shirt, you can unhook it and nurse that way, or you can pull your shirt up through the bottom of the carrier. I find that nursing out of the top is the easiest, so that I don't have to do so much with my shirt, and it's also the most discreet. So here, I actually have my breast out of the top of my shirt, and it's very hard to tell that my baby's even nursing. So a Mei Tai is a great, great option for nursing in public. After you're done nursing, you can reach your hand back in and pull your baby up to their height that you normally wear them at. Pull the carrier up around their head, tighten your shoulder straps, from here, you can go about your day. And that is how you nurse in Mei Tai.